Our NHS remains one of the UK's most valued institutions. It continues to do great things in the face of rising demand. But the NHS is facing more challenges than at any time in its history. We still have 7.5 million people waiting for planned care, 1.6 million people waiting for mental health support, and over 1 million people waiting for services in the community. Many NHS buildings are crumbling and in dire need of repair, often filled with outdated IT and equipment. There are over 120,000 unfilled jobs in the NHS, including a shortage of GPs and continued industrial action by staff, with many feeling underrepresented and undervalued. Our aging population means more people need support in the community, but a lack of resources in primary, community and social care, as well as mental health, means more people becoming more unwell. This increases the demand in A&E, making it more difficult for patients and more expensive for the NHS. Despite some recent investment, we still need urgent short-term action to stabilise the NHS, starting with resolving the staff disputes, dealing with the widespread underlying financial deficits, and avoiding any reorganisation at all costs. But in the long term, we need to do much more. We need to more than double our current spending on NHS buildings and technology so patients are safer and staff are more productive. We must fully fund the NHS long-term workforce plan and introduce a similar plan for social care. We need to move more care and interventions into communities, allowing people to access services closer to home. We need to move away from the short-term funding cycles that are holding us back and allow health and care leaders to plan for the longer term. But the health of the nation relies on much more than just the NHS. Good quality housing, access to nutritious food and clean air are just some of the important aspects of national health. So we need a national strategy for health, with government working across different Whitehall departments. Building the health of the nation will help us build a stronger economy. Our evidence shows that every £1 invested in the NHS can return £4 to the economy. NHS leaders are ready and willing to do everything they can to transform services and improve the care in their local communities. But they need the next government to play their part too, to build the health and well-being of us all and of generations to come.